Good evening, everyone. Am I audible?
Yes, Sumaya.
Okay. Good evening. I warmly welcome you all to today's international session under the International Free Workshop 2026 series. I am Sumaya Bashadola, Assistant Academic Lead at Bangladesh Institute of Innovative Health Research, BIIHR. And it is truly an honor to host this important session today. Thank you for joining us from different regions and professional backgrounds. Bangladesh Institute of Innovative Health Research is a non-profit research-based organization established to promote a strong research culture, especially among undergraduate students. We focus on empowering students and professionals through research training, academic mentorship, and skill-based programs, creating a bridge between knowledge and real-world impact. Now, it's my great pleasure to introduce our esteemed facilitator for today's session, Dr. Ritika Mukherjee. Dr. Mukherjee is an honorable advisor at Bangladesh Institute of Innovative Health Research and currently serves as the Deputy Director of Knowledge Management and Learning at GRID Council, Noida, India. She holds an MSc and PhD in Population Science from the International Institute for Population Sciences, Mumbai, India. With her extensive academic and research expertise, particularly in population science and public health, we are truly privileged to have her guide us through today's topic, Introduction to Qualitative Research in Public Health. Before we begin, a few quick instructions for today's session. The session will run for approximately 1 to 1.5 hours. The language of instruction will be English. You may ask your questions through the chat box or orally during the designed Q&A segment. We encourage active participation to make this session interactive and impactful. So now, without further delay, I would like to invite Dr. Ritika Mukherjee to lead us through today's session. We are excited to learn from your expertise, ma'am. Over to you.
Thank you, Sumaya, for that introduction, and thank you, everyone. So I'll just would want to first share my screen. Could anyone please confirm if my screen is visible?
Yes, ma'am.
Yes, ma'am.
Okay, thank you so much. While I'll present, I'll not be able to see you all because my screen is being shared. But I would request you all to write your questions there in the chat box whenever you feel, and we can take it in the designed Q&A session. So to begin with, so we have this session, Introduction to Qualitative Research in Public Health. And I thank Bangladesh Institute of Innovative Health Research for creating this platform, and I have been associated with them for a few years now, and it's really a great pleasure to see that you all have expanded, and this time we have cross-country students, young researchers, and this definitely shows that how young researchers are so motivated. I'm sure it is the fag end of the day in Bangladesh as well as in India, but I see there are other people from across the countries and at different time of the day, and all of you have taken this effort to actually join in, which is really quite motivating for me also as a public health researcher, and I thank all of you for joining it. So as I was introduced, I'm Dr. Ritika. I'm based out of Kolkata, India, and I'm currently working as the Deputy Director in GRID. So why should I be talking about qualitative research, and why should you actually take my knowledge? So, just to give you a brief introduction, as I was introduced, I had done my PhD. My PhD was completely on qualitative research. I worked on surrogacy, surrogate mothers in India, and it was a pure qualitative research. And later on, I joined an organization which is in Klein, in India itself. And I was working there as a research officer for quality, senior research officer for qualitative. And at present, I'm working as a deputy director in GRID. Now, GRID is a public health research organization, and here we have done more than like 60 projects, which are mixed method research. Mixed method means both quantitative and qualitative, and qualitative component has been quite prominent in these research, these projects. And so I have like a fair idea of how qualitative research is done. So to begin with, let us start with a story. This is a project that we did in one of the Indian urban slums. The Indian urban slum was in one of the metropolitan cities in India, at the heart of the city, not on the peri-urban area. These are some real life snapshots of these of the urban slums. Here, about there are a lot of residents. They have shared sanitation, limited water supply. Majority of the families here are daily wage workers, and here the women who are there, they are both into household chores and childcare responsibilities, and many of them are domestic helps. So here we went into this urban slum and we tried to do a situational analysis on the uptake of maternal and child health services which are being given by the government. This was also a mixed method study where we did a quantitative survey first. Quantitative survey is basically a tool which had a list of questions. We went house to house, tried to see that, what kind of uptake service has been showing up in this particular urban slum for maternal and child health services. Now, when we went, the first thing that we saw is the survey results, and we saw that 97% of the women had their pregnancies registered. 96% of the women had received all antenatal care services. 99% of the births were institutional. So institutional deliveries, that means they were not home births, but they were the births were at the hospitals, the institutions. So if you all can just say in the chat, or you can just call out, like, what do you really feel that, what does this data say about the healthcare services and the reach of the healthcare services within the community? Anyone? You can type out in the chat also. Okay, is anybody typing out, or should I just say? So I would also request you all to do some chats. I know it's like at the end of the day, but then still, if you all can, I would want it to be a little interactive, please. So when we see these percentages, it's 97, 96, right? 99. So this shows that the healthcare service uptake in this particular urban slum is fantastic. The reach of these services are also very, very high. And institutional deliveries are happening. That means people are more or less like abiding by the system. When we went ahead and we then interviewed the mothers, and we also did some interviews of the fathers of the children. So just to give you a context, the eligibility criteria here was women who are pregnant, they were participants, and women who had child less than 5 years of age, they were also eligible for our study. And of course, their fathers, their mother-in-laws, they were also interviewed along with the mothers, the pregnant women, or the mothers of the 5-year-old children. So when we went ahead and interviewed, we saw that, they said, one of the pregnant women said that if we go to the hospital at 9 a.m., then we return by 5 p.m. We get water only 3 times a day. If we miss that, the whole family suffers. This shows that there was some hesitation of these women to actually go and take the services from the institutions, the hospital, the public health hospital itself. And if I have to go a little deeper, maybe from 9 to 5 means there was a lot of queue. It was very crowded. Maybe the facility did not have as many doctors to the doctor to patient ratio, and it was not very smooth. So there was some resistance from the community to go and take the hospital services from the facilities, as it is being portrayed in this particular um, quotation. One of the fathers that we interviewed, who had a 1-year-old child, he said that from the time my wife became pregnant, no health worker has come to our house. We did everything on our own. What does this mean? So here it is showing that there was, so when he's saying that the healthcare worker has not come to their house, that means the frontline health worker has not come to their house to give the services, but they are doing everything on their own. What does this mean? That means the public health services, for both the quotations, it is showing that the public health services, there is some resistance from the community to take that because of time management, or quality issues, or the reach of the public health services is also not optimal, because the father is saying that they are not coming to the house. Here there is a gap between what my quantitative data is saying and what my qualitative data is saying, where my quotations have come from the interviews, which are my qualitative data. So my data of the services are saying that they have reached people, because my reach is fantastic, everything is over 90%. But when I'm going and interviewing people, they are giving a different story. So why is this experience versus the survey so different? Here is where the qualitative research, the importance of qualitative research come in, when there is a gap between what your survey is saying versus what people are actually experiencing in the community. So in order to explore this gap, the qualitative research have come in, where to answer what the quantitative research cannot. So why do we need qualitative research? Qualitative research basically explores human experiences, perceptions, and behaviors. And in depth, it goes into all the nitty-gritties of those experiences to understand what is happening, to why is it happening, and how is it happening for that particular context. Here, the data, instead of numbers, it comes as in words, narratives, observations, rather than numbers. So why are we doing qualitative research? It is basically to explore the whys and the hows of the data. What is mostly being answered by the quantitative aspect. But to see why is it happening, why the people are saying what they are saying, how are they managing their challenges, it is the qualitative that comes into play. Qualitative focuses on lived experiences, perceptions, and the social realities. So it is very much focused and rooted with the people, and therefore it is quite context sensitive. What is true in India is not true in Bangladesh, is not true in Africa, is not true in Japan, and it can be very different in America. within India, within Bangladesh, within Africa, within Japan, within America. There also within between states, between cities, between districts, between rural and urban, the context differs. And what is true to one person in rural India is not the same what the experience is what the person is experiencing in urban India. And again, as with this particular example, we saw that within urban also there will be a lot of discrepancy between a slum area and a non-slum area. So qualitative research is grounded in the context, and the context realities get surfaced through the qualitative research. And it is quite flexible and inductive, meaning a lot of iteration goes in with the questions, with the the narratives that come in. And in qualitative, it is the interviewer or the researcher who's actually interviewing the people is the tool. A lot depends on how I, as a researcher, is asking the question from the participant to get the right data. So a lot depends on that. So here in qualitative, we say that interviewer or the researcher is my tool, is more important than the paper, the tool paper that you have, the question, the list of questions that you have in. To have a very distinction between qualitative and quantitative, I have put in the qualitative first. So when I'm explaining, the quantitative is here. So in quantitative, basically, what are we trying to explore? How many, how much, what is the rate, what is the proportion? So we are getting into numbers, the statistics, the measurements. But in qualitative, as I just explained, it is mostly on hows, the whys, what does the person mean by what they have said. The data kind of comes in the narrations, the answers, the narrative answers that they give, and also observations. For example, the example is the photographs that I showed. When you walk into a particular field, you see a lot of the surrounding, how the the slum area is, what kind of water supply it has, what kind of drainage it has, does it have a shared toilet, does it have does it have health facilities nearby, is there a private facility, how well is it connected with the main city. So a lot of observation also happens in qualitative research when you actually go and visit the field. In qualitative, when we say the sample size is very small when you compare it with the quantitative, because in quantitative you will see large sample size and it gets into a generalizable finding. So here what you do, you first calculate the sample size based on your prevalence of the problem, and then you pre-decide that, okay, I need to reach 300 people, 350 people, 700 people to get the answer, which can get into statistical significant results. But in qualitative, we don't interview 300 women. It is mostly purposively selected. Why do I want to interview women? So here, the sample size is way less than compared to quantitative. But in case of qualitative, it gives a very deep understanding. But it is not always generalizable because it is very context specific. So in qualitative, it is basically the depth of the interviews, the depth of the understanding that you gain in qualitative. In quantitative, it is the breadth. So it is basically the breadth versus the depth. That is the difference between quant and qual. We will talk a lot more about the methods, but just to talk about here in qualitative, it is mostly through interviews, which we call as IDIs, like in-depth interviews, KIIs, key informant interviews, focus group discussions, which are FGDs, and of course, observations. In quantitative, it is mostly the surveys, the RCTs, the randomized controlled trials, and the cohort studies, and so forth, so on, which are getting into quantitative phase. Now, what kind, the different common qualitative study designs that are there? One is the phenomenology. What is phenomenology? It is basically about a lived experience of a phenomena. For example, we all have experienced COVID. If I have to see that during COVID, what did the mothers experience uh, for uptake of maternal health services, so that it becomes a phenomenology. Or if there is a flood or a natural disaster in some area, and if I want to see that how did that person experience a particular service during that natural disaster, so that gets into a phenomenon, and when you study that, it becomes phenomenology. There is one thing which you will come across which is called a grounded theory, where you interview people and then you try to build a theory out of the data. For example, here, if I want to see that how do ANMs are auxiliary nurse midwives as we call it, or frontline care workers, if I have to say it in a more broader domain, how do they develop their own referral decision making processes? How do we get that? By actually interviewing many such frontline health workers, we will see that how they have developed their own referral networks. And by developing that, we will try to build a theory to say that, okay, this is the theory that I propose to show that, okay, frontline health workers develop their referral decision making process in this manner. So where I'm trying to build a theory out of the qualitative data, that is my grounded theory. A case study is when we learn from these specific cases. For example, there are two slums. One has not improved on ANC utilization, whereas the other has actually improved a lot and is giving very good results. If I have to compare between these two and I have to understand what has happened in one which has led to improvement while the other did not. So here, that particular slum can become a case study. What is very generally otherwise done is a very descriptive qualitative design, where we just want to know what is happening and how it is being experienced. For example, we say that how do families in urban slums perceive and respond to danger signs during delivery? So here I select a place, I want to go there, I interview different people, and I understand what is happening and how it is happening. Now, what kind of qualitative data do we really get? As we mentioned, you see observations, field notes, memos. So there is called a walkthrough observation. You first go to the field, you understand how the field is structured, where is what kind of facilities are available, and all this will set your context. Then you go to your participants, depending on your eligibility criteria, and you do some interviews, you do some group discussions. You also click a lot of pictures. You can also do a videos. And then all those things are also a part of your qualitative data through the picture only. For example, the pictures that I just showed you, even though you have not visited the slum, still all of you could get some idea of whether the drainage was open, not open. It definitely showed that the water supply is shared. A lot of people had their containers ready to get the water done. What kind of drainage system, what kind of water supply, all these things will be visible through different pictures that you select. Documents and reports, if they are already there and you want to go back and you want to review those documents, narrations, and reports, they are also a part of qualitative data. Now, how is sampling done in qualitative? It's not that you just walk into the field and you start talking to different people who becomes your participant. There are different ways of sampling in qualitative research. Who do you talk to and why? Of course, that why part is also very important in qualitative, because that will determine who you want to go and really talk to. There is something called purposive sampling. From the very name of it, you understand purposive means purpose. So here we are actually going and selecting participants who will have some experience and knowledge to answer your research question, your research objective. For example, here we are going to mothers and suppose we want to understand delayed antenatal care services, then we will not go to all mothers. My purpose is to understand why mothers, some of the mothers are having delayed ANC practice, services. So I will only go to those mothers who had delayed antenatal care services. There's something called snowball sampling, where one participant will give you knowledge about the other participant, and this is mostly in case of hard to reach areas. For example, in my PhD thesis, where I actually interviewed surrogate mothers, of course, I cannot just go and I will get surrogate mothers in a group. So I had to go interview one surrogate mother through, and I got her contact through the doctor. And then I interviewed one surrogate mother and I asked that, do you know any other women who have had been a part of a surrogacy arrangement? Do you know her? Do you have her address? Can you really talk to her and see if she is interested to participate in the study? And so I went from one person to the other, and from that to two more. So it gets into like a network, a chain of participants. So that is called snowball sampling. There's something called, when you do sampling, you will say that we selected participants to have maximum variation. What is maximum variation? Where you deliberately choose participants of different profiles to get a more comprehensive, more wide range perspective. For example, if I have to see mothers, ANC uptake, I do not only go to rich mothers, I also go for mothers who are lower socioeconomic, having lower socioeconomic conditions, some mothers who are educated, some mothers who are not educated. And I want to see how the uptake of service is differing for different particular groups. So that is called maximum variation. I also go and see for saturation. For example, in quantitative, we said that, we do a sampling size calculation and we say, okay, I need to reach 300 population of this particular profile. And I reach 300 and I stop. In qualitative, that is, saturation is your stopping rule. You generally, when you write your paper or you write your report, you say that we will interview about 10 to 20 mothers who had delayed ANC care service, for example. But you see that your when you have reached your 12th or 15th participant, you see that you are not getting any more new information. You see that the 16th mother or the 17th mother is adding the same information as done by the other mothers that you have already interviewed. So when it is no new insights are coming, you decide that, okay, let me not go and interview two more. I can stop at 18 because I'm not getting no more new information. So then I hit what I call it, like what we call it in qualitative, is we have hit saturation at 18th participant and therefore we have stopped interviewing. So generally for in-depth interviews, it is 10 to 20 participants of a similar group, a homogeneous group. And for FGDs, it is 3 to 5 focus group discussions that will help you with saturation in your data. I'm trying to just very simplify. If you still don't understand or you have further questions, we can discuss later. Now, what are in-depth interviews? In-depth interviews are the most common ways of collecting data. And this is definitely something that is always there in any qualitative study that you do. It is a one-on-one conversation between the researcher and the participant. And this basically explores that particular individual's perception, experience, and meanings that that person has associated in her or his narrative. In-depth interviews are very useful when the topic is sensitive, when you cannot really ask a person maybe about the mental health condition or domestic violence or cultural barriers. In a group, people will not come up with their nuanced narratives when they are in a group. But if they are one on one, they will be able to talk their heart out once you have built a rapport. Individual's perspective is key. My experience as a mother and X's experience as a mother's and Y's experience as a mother will differ, even if I'm staying in the same slum. Therefore, in order to understand the differences, variances within the experience also, you need to interview every individual to understand how that person has um, experienced one particular phenomena, and what kind of challenges that they have experienced, what kind of enablers they have had, and how they have actually maneuvered through the system. And there can be some diversing and conflicting viewpoints, which is not always easy to capture in a group, and people will not be comfortable also. So therefore, in-depth interviews become very good tools or ways in order to capture individual data. But before doing any interview, it is important to have a rapport with your participant first. So, some small talk, some explaining purpose, why we have come, ensure that the participant is comfortable, ensuring that, whatever data you are giving to me will only be used for the research purpose. I'm not going to, talk about you and your experience with many other person. I will keep all your data confidential. People will not be able to understand that, this is you who have told about your experience. And this is very crucial, especially for sensitive topics. Uh, while interviewing, it is very important to follow up with why. And can you explain more? For example, if somebody says that, the medicines which are given by the primary healthcare facilities, I don't take them. I rather buy it from the private facility. You don't stop there. You ask the person, why are you saying that you don't take these medicines? Why do you prefer to buy the medicine from the private, where you have to actually pay for it, whereas in public you get it for free? So only then will the participant come up and say that, okay, this is my reason, these are my experiences, that is why I have chosen to buy my medicines from the private and not go with the facility, the medicines given by the public health facility. So then you understand it, you realize it, and then you give your feedback, and then the public health system also improves. There can be miscommunications, there can be lack of access, there can be multiple other factors which actually get into. Then you need to also probe actively. You don't just stop at yes or no question. You need to always revisit your question to see whether it is very leading questions, whether you get your answers as yes or a no. It's not like, did you get your service from the private facility? The answer would become, yes, I have, or no, I have not. I have gone to the public. How does that help you out in a qualitative? So it has to get into, tell me more about it, ask me why. You have to listen more than you speak. As a researcher or an interviewer, you have to give the lead to the participant, and you must audio record. Like, it's a good practice, but you have to audio, if you audio record, not always, but of course with consent. If the participant is not comfortable, you don't audio record, but otherwise in qualitative, it's a good practice to do audio recording, but of course maintaining confidentiality, because that will give you very nuanced data. For one person to listen and write notes, and also not, and also to make the participant feel comfortable, is not easy. There is something called key informant interviews. So in-depth interviews, you're doing one-on-one, but with the participant to understand their experience. Key informant interviews are basically done with people who are having specialized knowledge or authority or a unique vantage point. For example, you go to the community and you talk to the community leaders or the NGO person who's working in that community. You don't ask about their ANC uptake. You are actually going to the NGO or authority, or going to the community leader, who has a good knowledge about the community, and you talk to them understanding what is happening, the um, dynamics of the community. So it is mostly the person as the lead. Okay, so the program managers, the health officials, the medical officers, you will not get them 20, 30 in number to get your saturation hit. But here it is a key informant. By the word key informant means the person who has a lot of knowledge and can be a key informant to your particular study, giving you a lot of information about what is happening. Then there is something called focus group discussions. Focus group discussion is like, as you can understand, it is group. The interviews are done in a group where you actually bring in at least 8 to 10 participants of a similar profile, make them sit and ask them some questions which are not very personal, but it is more on the general practices that they have been doing. And here it is can be about what kind of norms are there, what kind of belief system, what kind of practices are there. You understand the group dynamics also, where you will have some conflicting ideas also. Those are also okay, and it is mostly a range of perspectives you will get at a very short span of time, because the when it comes to FGDs, they generally go in for like 45 minutes to 1 hour, and you can understand that what are their perspectives overall as a community. Here in FGD, always there are two people: one the moderator and one is a note taker. Unlike an IDIs, whereas IDIs also you can do with two people, but you can if the participant is very comfortable, because in IDIs it is mostly individual experiences. Uh, so key roles in FGDs. Uh, is anybody saying something? Okay. So key roles here is the moderator, who is actually facilitating the discussion, asking questions, making everybody talk, while there is another person who's quiet and who's called the note taker, who's actually taking all the notes and understanding who's saying what is the group, the dynamics of the particular group, and so on. Now, when you're designing your interview guide, so that is about the interviews, what kind of different methods of techniques that you can actually use to collect your data. But while you're designing your interview guide, then also you have to keep something in mind. Firstly, when you're going to interview, you have to introduce yourself. You have to tell the participant that, okay, this is my purpose. You take the consent of the participant. It's a good practice to take a prior appointment. And by doing some small talks, you build some rapport, and then you get into some ice-breaking questions. You generally don't jump into a sensitive question. You ask more of a broader question so that the participant first opens up and starts talking to you. So generally the first question is like quite broad, and it is an overall, and it's a long answer generally. And then you get into specific probes, specific questions, asking specific details of your questions and subject. If there are sensitive topics, make sure that you are very neutral in your body language, you're neutral in your language. There should not be any kind of facial expression that shows that you're judging the participant. You have to be very neutral, because otherwise the participant will not be comfortable to talk to you. And once you have actually explored, you generally say that, okay, I have exhausted my questions. Is there anything that you would want to add from what we have discussed? You should always ask this question, because most of the times by the end of the questionnaire, the participant becomes very comfortable with the researcher, and that is the time they come up with very good insights. So the closing question, it plays a very important role in qualitative interview. In qualitative research, there are certain ethics that one needs to follow, and that is whenever you're going for a qualitative research, there has to be an ethical approval taken from the institution from where you want to apply, so that there is confidentiality, anonymity is protected of the participant. So the participant's name, identity is never to be disclosed. The audios that you collect should be renamed, and you should have a way in which you can actually ensure that privacy of the participants are maintained to the utmost level. You always need to take an informed consent of the participant. There is something called participant information sheet, which is generally given to the participant. An informed consent is signed by the participant, where one copy is generally with the participant and you keep one copy, and then you start the interview. There is also, if you're doing a recording, there must be a consent for that also. It's not that you do it by hiding it secretively and then without the person knowing. That's violation of the rights. So for all these, and all these are all noted down in your proposal, in your tool, in your participant information sheet, and all those things get through the ethical approval of the research institute. And of course, the last thing is power dynamics. You need to ensure that the participant is comfortable. If I say that I'm a very hi-fi doctor and I'm actually interviewing a participant who is from a very low socioeconomic background, the participant will not be very comfortable. So here the researcher need to make sure that they understand the power dynamics. You need to bring yourself down to that particular level where the participant will feel that you are one of them, you understand their problems, and you don't judge them, and there is no right and wrong answer for what they are saying. So there it has to be absolutely neutral and non-judgmental. And then once you get your data, what you do, you have your audio recordings, you get through the transcription. But transcription also has to be done in the proper way. That is the first step of your data analysis. You first listen to the recording, you understand what is being said, you get familiar with the conversation. And when you are transcribing, it has to be verbatim, in the sense where if the person is repeating some words multiple times, keep them. If it is pausing, you keep the pauses. If the person is laughing, you say that, okay, the person laughed here. And if there are some incomplete sentences or people have changed the subject, you mention that. You also have to take care of the non-verbal cues when you are doing interviews. So when you have your transcript ready, you have to write that, okay, during this time, the participant was hesitant to say, the participant was not looking at me while answering this, so all was not feeling very comfortable, tried to shun away that question, and so forth, so on, to understand what the person is actually saying. So the body language, the non-verbal cues also become very important in qualitative, and all those things are written in the transcription that you do, the transcription. Using timestamps in transcriptions are also a good practice, because many a times when you read a transcript, you will not understand what the person is actually trying to tell you. So a good practice is if you write down, okay, at 23 minutes 27 seconds, this participant has said this, not for all, maybe 5 minute gap, then you can go back to your recording, you can hear it out again, and you can understand better when you actually hear it out from the participants verbally. And you have to read the transcript along with your audio, and you have to see that whether there is any discrepancy, whether there is any it's not coherent. Then you have to correct those errors before you analyze. So this particular just like quantitative, where you are actually having a step of cleaning your data so that your data is ready to be analyzed, this is a process of cleaning your qualitative data before you take it further for analysis. If the language is different, for example, if you have done your interviews in Bengali, but of course you cannot write the paper in Bengali. So in that case, what happens? Your translation comes in, and so first you have to transcribe, then you have to translate. So first you transcribe in Bengali, then you translate that into English, and then you have to back translate to see whether what is being said in Bengali is coherent and consistent with what is being typed in English, so that the meaning of the sentences does not change. There are certain softwares which are used for qualitative, for example, NVivo, Atlas TI, MaxQDA, but mostly many of the analysis are also done using MS Word, MS Excel. Word is mostly used for doing the transcriptions, translations, and writing notes here and there. NVivo Atlas TI also helps you with that. But you need to remember, no matter what, softwares help to facilitate the analysis, but it never does it by themselves. The analysis has to be done by the researcher. Unlike quantitative, where you get your p-values, you go get your mean median mode just by running the your regressions and your analysis. In qualitative, you have to do it yourself to find out the meanings, the finding out the patterns. That is a researcher. It's not the um, software doing it for yourself. It is facilitating it. It will help you with it, but final thing you have to do. Now there are 6 phases according to Braun and Clark, which is this is the most basic way of analyzing qualitative data. Firstly, it's familiarization. That happens when you are transcribing, translating, hearing your audio time and again. So you get very used to the data, the information which has been given by the participant. Second is generating the initial codes. For example, you highlight what words, what phrases, what ideas are actually standing out in the transcript, and you start making notes here and there, scribbling that, okay, this is why, these are the reasons for the whys and hows you want to explore. Then after you have done your generating your initial codes, you go for searching the themes. You have tried to understand what kind of patterns are coming out of these codes, and you see that, okay, these are your themes that are coming out. You re-review the themes and see that, okay, can these themes be merged? Can they be, are they talking about the same thing? Do we need to split? Is it like too much, too dense? So all these reiterations of the themes has to be done after you have generated your themes. And then defining and naming the themes is done once your list of themes are ready, and they are quite exclusive of each other. And then you have, so basically you have themes, you have sub themes, and then after you have collated all the themes, you start writing the narratives to build your analysis. In qualitative data, quotable quotations are a very, very important aspect. Quotable quotations will help validate your answers and validate your findings, but it should not be used just for the sake of using. One, you should not repeat quotations for what you have already explained. It should be something that validates what you have said. Second, do not leave quotations for the readers to interpret. There has to be an interpretation followed by the quotations. Quotations are not your analyzed data. They are just used for validating your findings. So that is one important aspect of analysis that needs to be kept in mind. Now, if you read this, that these are the 3 quotations of like one mother, one father, and one ASHA worker. So here, ASHA worker means a frontline healthcare worker. So here the mother is saying, I did not go for my checkup until the 4th month because my mother-in-law said it is not necessary to go so early. One of the fathers said, I did not take her in the first trimester. I was working. I thought the pregnancy was fine. She was not in pain. So why to rush? There was this ASHA worker who also informed that many women delay because they feel if they tell people early, it brings bad luck. It's a cultural belief that is very common here. So if I see the first 2, there is one theme that is coming up, that while a lot of gatekeeping, social gatekeeping for healthcare access is being determined by the family, where the mother-in-law felt that it is not necessary because it is too early. The father, the husband here, basically, not the husband of the pregnant women, here he felt that since the mother is not in pain, then it's okay not to take her to the doctor, and it's okay not to take any ANC during the first trimester because she was fine. So the gatekeeping, so here the theme is coming that a social gatekeeping is being done by the family, which is delaying ANC service. And if I have to see the ASHA worker, you see there are cultural beliefs that they are talking about. That, if they are in the first trimester, it is a very sensitive and vulnerable period where most of the miscarriages happen during the first trimester. So if they tell people a lot, that means some bad luck would happen and that woman can experience a miscarriage. So it is better not to go for help, to not to seek health services, because it's a cultural belief, and that again delays the ANC. So overall, if I have to see here, two themes are coming in there. As gatekeeping is being done by the family, and also some cultural beliefs. So two themes. For the bigger theme is delay in ANC care. So that is how you analyze your data. This is a very simple example that we have tried to put in, but that is the theme is delay, reasons for delayed ANC, and two reasons, the sub themes are coming this. Now, when we are doing some qualitative research, what are the common mistakes we do generally? It is like treating qualitative data as quantitative. We mostly go into yes and no answer. That's not qualitative. Choosing participants just for convenience and not understanding why should I choose that participant, what kind of information should I be getting out of it. Leading question in the interviews, where you try to frame questions in a manner when you are asking as if you are posing, okay, this should be the right answer. For example, if you say that you must have gone through, you must have taken your started taking your first ANC when you were second month, or when you were in your first trimester. That shows when you are saying questions like must. So how was your experience then? So those are your leading questions where the participant will feel that, okay, I did not take my ANC service during my first trimester. So then what was it wrong? And they might not come up with the real answer then. Stopping too early, and then you will get into insufficient data. Therefore, we always try to, as I was mentioning, that closing questions are also very, very important. And you as a researcher, we should not become like very impatient and say that, okay, it's already half an hour, let me close the interview. And then you may lose out on a lot of information. Quotes are not analysis itself. I've already explained that. And ignoring research positionality, which is being reflexive. You need to make sure that you understand what is your position, you understand the dynamics between the researcher and the participant, and you do not bring any kind of your own judgment into the analysis of the data quality. So data analysis and interpretation, you don't bring in your own perceptions and judgments. So you need to be more reflexive. So that's the end of my presentation. And I would really like you all to just type out one key learnings that you have had from this particular session that we have had. I would want to close down by saying that William Bruce Cameron said that, and he's one of the very big sociologists, he said that, not everything that can be counted in numbers counts, and not everything that counts can be counted. So for that, it is mostly like you need some interviews, more exploration in and this very fits well with qualitative, and so I have put it here. So thank you for that, and we can now have some questions and answers. If anybody has any questions, you can just type out.
My question is, how can we determine the data saturation?
Sorry? How can?
How could we determine the data saturation?
Okay. So data saturation is determined with practice. And so there is a general rule that if you are interviewing common party, like participant for of a very common group, then you need to interview at least 18 to 20 of them to hit saturation. When do I say practice? So if you are the person who is interviewing and you are interviewing many participants, you will understand that the same information is coming up and again. You will find it maybe in the 12th or 13th interview itself, but you will see that this kind of information, the same patterns are coming out. So you have interviewed me, I have given you some information, you interview the second woman, third woman, fourth woman, and then by the time you go for the 13th woman, you see that whatever has been told by women 1 to 12 is actually uh, repeating for the 13th and the 14th women. So then you hit saturation, and then okay, you decide, okay, let me do 2 more, let me get very confident that I have hit saturation, and then I'll stop, I need not do the 2 more. So that is how. So basically you need to keep on analyzing your data while you are doing your interviews, and you as a researcher will understand that you have hit saturation. There is no formula for it. It is basically you understand the same information is coming up and again. Have I answered your question?
Yes, got it.
Thank you. Any other question?
Regarding
Ma'am,
data
can you?
situation that earlier asked, I want to add another question that if I collect data in rush, like I don't have enough time to analyze data during data collection, how I will understand that if I reached data saturation or not?
So if you are not having time to analyze, and you are the one to do your interviews, okay, you are not actually delegating that work, you know that okay, I will not be able to analyze my data because I don't have time, then you as a person, when you are interviewing multiple participants, you will understand, because you are the one listening, and you will understand that okay, this is what everybody is saying. Like for example, this is what everybody is saying, so I need not like go ahead and do more. So that's your self perception, and that is why I said that it will come with practice.
Okay, thank you. One more thing I want to ask you that like in this era of AI, artificial intelligence, may I use like AI for coding from the data transcription or generate the theme from the transcriptions?
So in NVivo, I use NVivo personally. So in NVivo, there is a feature which is called NVivo coding. So what they do is, that is AI helping to and go through the transcription and generating themes just by going through the transcription. So that is what is done by NVivo. So it will generate your themes. So if that is what I talk about software. If I have to see AI, if you have a paid subscription, and again, there is some ethical issues with AI, because when you are uploading transcripts and all, it gets into public domain. But AI could also be used. So if you have that kind of version, if you have those things, AI could also be used for generating themes. But one red flag here is, do not blindly trust AIs, because with more usage you will understand that they have this loop of generating and telling you the same story time and again. So in order to go for very nuanced findings, it is a best practice to apply the brain of the researcher. Take the help of AI, but take the help as an assistant, but don't blindly trust AIs. So that is my suggestion. But there is one feature in NVivo, as I said, that can be used for creating themes automatically. Yeah,
Thank you.
thank you.
Oh, I have a
Thank you, Doc.
question.
My question is on the key informant interviews. So when you're conducting them in the methodology, is there something like a minimum number of the key informant persons you have to interview, or is there a guide or around that? Because I think you had mentioned that even one person can be interviewed as a key informant. Is there a guide on that one, Doc? Thank you.
Thank you for the question, and it's a very good question actually, because in qualitative data we always talk about saturation, and when we are talking about saturation, we are saying it comes with numbers. But key informants, if I have to interview the President of India, there is only one, so I cannot get numbers. Then how do you decide that when to stop with the key informant interview? So for key informant interview, if you see, I introduced a term which is called maximum variation. Though I talked in terms of IDIs, but key informant interviews is basically when you see that who all you need to interview from for a particular study, so that you get a comprehensive understanding of that particular context and particular research question. So for example, for the example that we saw in an urban slum, and we are talking about uptake of maternal and child health services. So just by going, so besides the mothers and their husbands and the mother-in-laws that we have interviewed, if I just go to the community leader and get their perspective, his or her perspective, that is not enough. I will not get multiple community leaders, so I cannot do 20 community leaders. But I'll have to go to the facility, the public health facility, and see that, okay, what are the medical officers saying there? If there is any quack doctor, I can go and interview there, the quack doctor, and see that, okay, what kind of services are the mothers coming from that doctor. If there is a private facility, I can go there. If there is a politician, I can go and talk to that person. I can also, if there is an NGO working there, I can go and talk to that person. So it is basically the varied perspectives that you actually get to get a comprehensive understanding what is happening and why is it happening in that particular community. So that is when you feel that, okay, there is nobody else who needs to be interviewed and I have actually covered all kind of stakeholders, then you stop. Have I answered your question?
Thank you very much. That makes a lot of sense. You've answered it comprehensively.
Thank you. Thank you so much. Any other question?
Yeah, I have a question.
Yes, please.
Is it result from the qualitative research can be generalized to the population, despite that I have seen the number of sample size is quite small compared to the quantitative. And the second one is the data collection methods, in-depth interview and focal group discussion. Can you use one or it should be combined, all of them?
Okay. So to answer your first question, in qualitative, we did talk about a lot on the context, right? So context becomes very important, and qualitative studies are always criticized for its generalizability, where people say that, it's qualitative data is not generalizable, and it is true. It is not generalizable for the entire population, but it is generalizable for that particular context. But here, when I'm talking about context, it means that particular setting. So if I have done what I have done for that particular urban slum, will be true to that slum definitely, and that is how you are actually hitting saturation where no new information is coming. But I can assume that, okay, what is happening in slum 1 is also happening in slum 2, 3, 4. But then some variations can happen also within that. It will not be exactly true. Okay. But without qualitative, we will not understand the whys and hows, and quantitative becomes very broad, and it will not give you the true picture. So that is how qualitative becomes important. Your second question on focus group discussion. Focus group discussions are also analyzed as in thematic analysis. We do for IDIs and KIIs. There, it is more like a general. So in IDIs, what is happening? It is about my personal experience, and I am saying it. A is saying, B is saying, C is saying, many others are saying it. But in FGDs, all of them are sitting together and talking about some common phenomena. And then in FGD, when you are also reporting your answers, you say participant 1, FGD 1, participant 2, FGD 1. So you can analyze it that way. You don't generally like combine that, okay, FGD 1 said this. FGD means it's a group, but it's not always necessary that the group in its entirety is actually communicating the same views. So you generally say that there were, say, for example, you did 2 FGDs and both of them had, say, 8 participants. And then you want to quote participant 5 from FGD 1. Then you give the quotation and you write participant 1, FGD 1, and whatever, like group of mothers, whatever. So it goes in that ways. You don't say that FGD 1 said this. That means you're actually generalizing the view for the entire group, which is not always true.
Thank you.
Thank you.
Hello.
Yes, please.
Ma'am, can you tell a little more about the themes, sub-themes, and the coding?
Okay. So themes and the coding, basically that's a part of your analysis part. So what you do is you have interviewed multiple participants, and the example that I showed was the reasons for a delayed antenatal care. Why do women delay antenatal care services and not always start their services from first trimester? Okay, so that was my answering to the why. So I had put in 2-3 quotations. So these are basically quotations, means excerpts from the entire interview that have come up from the interviews that I have done with a mother, her husband or a father of a child, and also the Anganwadi workers, the frontline healthcare workers. And when I see that, okay, the mother is saying that my mother-in-law felt that it's not necessary to go in the first trimester, so I did not go. So the person is not saying that I am controlled by my family, but the narration goes that, okay, my mother-in-law felt, and therefore she felt that, okay, it's not time yet, and she's an experienced woman, she has her children, and therefore she's saying that don't go now, you can go later. So the mother-in-law functions. The husband is saying that, okay, my wife, I did not take her because it was the first trimester, I was busy with my work, everything was fine, her health was fine, she was not in pain, there was no complications, then why to rush and take it for the first trimester? So that was basically showing the gatekeeping that is done by the family, so the delay that is happening because of the family. So that is your sub-theme. What is the other reason? Where the frontline healthcare worker is saying that there are certain cultural beliefs, and that belief we have in ourselves also, that, you know, if something good is happening to you, you generally don't go up and shout it out loud to the entire world. You keep it secret till the time when it has actually, quite settled. Then you go and tell the others. So for pregnancy also, first trimester is very critical. Most of your miscarriages happen there. So people generally avoid going to the facilities because as you can see, the houses are very nearby, and people will take a lot of time. If you go to the public health facility, then everybody will come to know, and people don't want that. And therefore, so that is another reason. So this is how you keep on finding patterns in your data that comes out through the different interviews, and then you analyze, you explain, you interpret, and then you validate with quotation. So that is thematic analysis. Okay.
Okay, ma'am, then what is coding?
Coding is when you are actually, when I'm saying that the quotation is there and you say that, okay, the mother-in-law is not allowing, the husband felt that the person is not going, the person is not in pain, so he's not going. So these are decisions taken by family. So maybe decision taken by family, decision taken by family. So these are coding. Free listing, basically you break your uh, narrations into very small parts of the data, okay, and then you try to combine and see what the data, those small bits are actually talking about. So that is coding. That entire process is coding. Have I been able to explain? Yeah, so somebody has given some definition. A code is a small part of the data. You free list, you break it, whereas a theme subtheme shows a more broader concept formed for several codes. That is what it is. Anything else?
Yeah, hi. So thank you so much for the wonderful presentation.
Thank you so much.
Like it was very beneficial. So I have a few questions actually. So I'm the PhD scholar and I'm doing the mixed method study, and I have already completed my first phase where I've done my like a qualitative study and all.
Hmm?
So right now like I'm writing manuscript for the publications in the Q1 journal. So like what are the guidelines that you would refer from your point of view to like while writing the manuscript to publish in the Q1 journal, which is Scopus Index, and if like when I'm following the like APA format for the manuscript preparation.
So, Mr. Kamal, it's like when you are writing your manuscript, there are different guidelines for reporting qualitative study, which is, if you see equator.com, they will have all the guidelines there for different kinds of studies. One is, for example, if it's a cross-sectional study, you use strobe. If it's a qualitative study, you use correct or SRQR. If it's like a mixed method study, there is a checklist for mixed method also. So generally, it's a good practice. So when you're reporting your findings, when you're reporting your findings in a form of manuscript or report, always take the help of those guidelines. That will help your manuscript be robust. You will not miss out in any of the methodologies. The chances of getting published also gets higher because people know that, okay, these things are checked. But also while doing that, you need to remember that not all points will be valid for your particular study. So you need to adapt a little bit, but the main pointers for which you definitely have an answer to will definitely be reported. So that is how you report.
Yeah, actually, like I have used the mixed method appraisal tool generally while writing the
Yes,
manuscript,
yes,
but
MAT,
after
MAT.
submission, yeah, I met. So, but they have refused it because they said like the APA format, like like it may like go according to the MAT, but like they have not agreed for that. They have given us the some other guidelines to be followed. So, any other suggestion that you would like to give?
See, APA is a referencing style. That is not a reporting
No,
style.
no. So that is referencing style is one other approach, but when I am writing any publication like manuscript preparation, there is a APA guidelines for the preparation of manuscript itself apart from the referencing.
Okay, okay.
Yeah. So in such scenario, I'm asking actually.
So if they have so what happens is MMAT is very broad, okay, in the sense because it basically talks about your quant and qual both, okay. But I would suggest then instead of MMAT, you say that you have reported your all qualitative findings through correct or SRQR and quantitative through strobe, and then you have tried to see through MMAT by reading through the both and whether all of it is addressed. I think that is the only way out. If the reviewer has not given more details about like how you improve. So if it is just on the reporting part, but if you can follow those publishing guidelines, but there has to be a reporting guideline so that you don't miss out on information. So they must have mentioned something in the guideline.
No, actually, they have not mentioned anything. And like I'm planning to submit again for the Q1. Let's say this is a different journal, and I'm expecting like if they accept like MMAT, or else they at least give the accurate name of the guidelines that like I'm looking for.
I don't, matlab, it's okay, fine that you would definitely have faced an issue, but matlab, APA is fine, but then you need to have, these are your guidelines. So you please check equator.com. There is nothing beyond equator where by which a journal can refuse an article because it's not abiding by the reporting guideline. Because if you, these are very validated guidelines.
Yes, yes, totally agree. Like, but still, like they are looking little bored, like forward than the MR, because nowadays the majority of people use MR only, right? So
Yeah.
if you want to now being as an Indian or in the Nepal or the developing like low or middle income countries, they always try to compare with the high income countries. So high income countries use different tools rather than MMAT and all. So maybe they are looking for that comparison from my point of view that I was like
No, not.
expecting.
I mean, not really. I mean, it's okay, but it's not about a comparison. I mean, MMAT and all. It's not been done by an LMIC. They are all done by HICs, and then things are different. Matlab, they are validated and accepted worldwide. But one more thing you can do is, if you whatever journal you want to publish, see some papers, what they have done, already published papers for of that journal, how they have reported, whether they have informed about any guideline, and you design your manuscript accordingly, because every journal will be different. So I would suggest go and check some published literature for that particular journal, and you design your manuscript accordingly.
Right. Thank you so much. Actually, I have prepared the manuscript looking at the like some of the journals, but like I think it's depend upon the reviewer opinion also, like how like what their experience is. Some of them have used the MMAT, and then some of them have used Prospero also, like that point of view. But like again, maybe person to person the opinion may varies. Anyways, thank you so much.
Thank you. Thank you.
Yeah, one more, like just a query, small query. Like, are we getting any kind of certification for this program by any chance?
That I don't know. I mean, the
Yes.
organizers can say.
Yes, you can get a certificate of
Yeah,
the.
thank you so much. Thank you so much.
Can
I
we
have a
get the
question.
PPT?
Sorry, ma'am.
Ma'am, I have a question.
Yes, please.
Ma'am, how can I find out the needy community? And another question, how can I find out the mm, key participant who gave me the key information for this interview session in qualitative research?
Okay. So, Mr. Pushpo, it is basically to understand what is your needy population, you have to do literature review. Okay. So, before doing any research, you have to build your research question. And your research question will be determined by the research literature review that you do before actually getting into the research. Once you do that, you identify which community you want to go. So what is the problem you want to find out an answer for? Then you see where this problem is prevalent, where after doing some research will give you some meaningful insights. So that is your next part. So that is how you actually determine who is your needy population. But one thing more that you need to keep in mind is, when you are determining your needy population, you also need to see your convenience, because you as a researcher have to go to the field and do those interviews, be there present. So it cannot be something where you it is which is not accessible to you. So so where the purpose is important, along with whether it is at all feasible for you as a researcher, especially at your career stage, whether that is feasible or not. So that is how you determine. And what was your second question? What was your second question?
how can I find out the
Acha, key informants, right? Ah.
जी मैम
Ah, so key informants you find out. So when you go, you have your research question. Then only you know that to fulfill. So from the research question, you build your objective, and from the objectives, you understand that okay, if I go to the community, who are the people I need to talk to or interview to understand to get a comprehensive understanding of that particular uh, this objective. So that ways you may have listed some things. Then you go to the community, you see around, you walk around, you talk to people, you build your rapport in the community. You identify the stakeholders who you want to interview and who falls into the stakeholder category you have predetermined. And then you ask the person that okay, this is my study, this is what I want to do, are you okay to participate? So you give the informed consent. You take informed consent of that particular person. First you see whether the person is interested, then before you interviewing you take the informed consent, and then you go ahead and do the interview. So that is how you go about it.
ma'am
Mm.
any other question how can I build good communications and convenience skill to get more trust uh, to the community so they can provide me very informative answers for my research.
Mhm. So here it is the skill of the researcher, and again that comes with practice. So how you are approaching. So for example, if you walk into a slum and you are all suited booted, then they will not see you as as somebody who they can relate to. Number one, so it's physical appearance. That doesn't mean that you are not properly dressed and you have to become one of them. No, I'm not saying that. But I'm saying that if you are walking into a community, you should be normally dressed. You should look approachable. You should make them feel that you are genuinely interested in them. You should talk it out. You should build the rapport before jumping into asking questions. Stay with them, talk to them, do some informal interactions. It should not like be only a give and take relationship. So it lot depends on how the researcher is approaching the field and the participant. So it's absolutely on the researcher, and that is a skill that you develop with practice. Yes.
Thanks ma'am.
Thank you. Mm. Yes. Yes, Tamni.
Can I ask you a question?
Yes, please.
I have a question in the part of sampling design. You are mentioning that there are four type of sampling. We know that sampling is divided in a four section: is cluster sampling, stratified sampling, simple random sampling. So these are the main core sampling part. But what you have said, snowball sampling and some other sections. So, if you mention or if you describe anything a little bit according to this section, so that would be very good and helpful
Nafisa,
for me.
what you just mentioned are sampling designs for quantitative data. Today we are discussing qualitative data. So snowball sampling, convenience sampling, purposive sampling, these are the ones when you are reporting your qualitative data, these are the things, these are your sampling strategies. So what you just mentioned about cluster, stratified, randomized control, so all those things are for quantitative. Okay.
Yeah, I can get your point. And
Mhm.
another question is how we can publish Q&A journal. So I face some problem in uh, now Turnitin AI detection is one of the most problem. When uh, I have completed all the paper, I have completed all the format and due to my journal, but in case of when I submitted in Turnitin, it's fluctuated that AI detection rate, and when I change the verb or all other things, and I also can detect it. So can we trust it again, turn it in AI detection? So what is
So
your point of view?
Turnitin is basically for plagiarism check, right?
No,
So,
right now it has also AI detection check.
so that is what your AI detection check means, whether you are taking as it is from AI or you have actually applied your brain as a researcher. So that is what it is checking, right? So that is what I was telling also, that you should not trust AI. And you if you nowadays, all the journals are asking whether you are taking the help of AI or not. If you have taken the help of AI, you have to write how. Okay, so it's not about trusting. You have to go for, like, if you're using Turnitin for AI check and plagiarism, whatever percentage it is giving, you have to take it at face value. You can use it for some other, use some other software also to check your AI, for your AI detection. But definitely, like, if you have to, like, go by the journals, they always ask you nowadays whether it is being generated through AI, and, like, if you have taken help of AI to draft this manuscript, and if yes, to what extent. So I would definitely say that AI is okay, but you, like, as a researcher, you need to apply yourself, see what is being said, humanize
No,
it.
I have written
Everything.
by my own hand, but it's AI detected unconsciously, but I don't know what to do. I have checked several times. It shows different. When I change the sentence structure in a academic way, maybe it Q&A journal type, but it shows detection, AI detection. When I uh, change the verb, and it cannot detect all the sentence. So there is, I think, I can understand your actually point.
Hmm. So you can check with another software. That is the only thing that you can do. Otherwise, I don't have a solution to that.
Thank you.
Thank you. Yes, next question.
Hello. I want to ask two more questions, if you allow.
Yes, please. I actually could see many other hands up also. So if you have already asked, can I ask the others and then come back to you, please?
Sure, sure.
Yes, please. Tamina Akhtar, you have been, like, raising your hand for a long time now.
Hello ma'am, I am Tamin Akhtar. I am a student of Population Public Health Science in Department of Social Relations at East West University. Now I am doing a qualitative data analysis course. As we know, in qualitative research, coding will be word-based, right? So I am not able to do data coding. I want to know how to do data coding from verbatim interview transcripts in qualitative research for using an in vivo.
So, Tamina, en vivo coding, I'll not be able to explain it here. I mean, that's a different session altogether. But I would suggest watch some YouTube videos. There are a lot of YouTube videos which are there. I had explained, like, during my session, as well as I think Vispandi, she also asked about the coding part. So I explained how it is to be done, like the basics of it. But I'll not be able to explain how, because NVivo has its own base. It's a software thing, and it's a different session altogether. But to help you out, please check YouTube. YouTube has a lot of videos, and it can help you out with, with the interface in NVivo. So that is what you can do.
Ma'am, I want to know how will I find out coding, because this is most of sentence based, not number based. So I am
So
facing lots of problem.
So, Tamina, you have to actually read through every sentence. You highlight whatever you are feeling. And again, qualitative analysis is not like quantitative. So, it's not like in one go you get the answer. You clean your data, upload in a software, and you get your p-values, mean, median, mode, and your table is ready. No. Qualitative analysis takes a lot of time. Okay, so you have to be patient. I'm sure you're doing it right, but you have to read. There is no other shortcuts to it. You have to read every sentence, see what meaning is coming out of every sentence. You write your notes, then you again aggregate the codes. You see whether they are talking about the same thing, different thing, completely different thing. You combine, you split, you iterate, you go back to the audios, you go back to your transcripts, and that is how the analysis is done. So there is no shortcut to it, and there's no like proper formula. You have to read through the sentences and you find out what the meanings, what is, the small excerpts in those sentences, and those are your codes.
Okay, ma'am. Thank you.
Thank you. Yes, Miss Kamrun Nahar.
Hello, ma'am. I had a question.
Yes.
It's about, for example, I'm assuming that I have a question. My study have data about quantitative, qualitative. Which type of manuscript will be have most possibility of to be accepted in any publications? Mixed method or quantitative or qualitative?
So Kamrun, what is your study about?
It's about pneumonia.
So you have some
children, pneumonia children who are under 5.
And you have done some quantitative survey of the children?
Qualitative, yes, and both.
So I think for this, it's best to, because it's children and it is, you will not have a lot of sample size, as I presume, right?
Yes, yeah.
You will only quantitative, if you publish, it will be very thin. Similarly, qualitative will, so first you have done, if I have to understand right, you have first done a quantitative survey.
Yes, right.
And then from there you have selected some subsample of children and you have done some interviews, right?
Yes, right.
Of their mothers or something, right?
Yes.
And then you have the data and they are more or less exploring the same thing, the same objective, right?
Yes, ma'am. Yes.
So it has to be a mixed method. So you will report your quantitative findings and then you validate it with qualitative findings. So it has to be a mixed method.
Okay. Thank you.
Otherwise it would be incomplete. Yeah.
Yes. Thank you.
Yes, Miss Anika Tehsin.
Thank you, Ms. Mukherjee. Based on today's session, qualitative research is essential for capturing the complex meaning of people's life experience, which can't be adequately represented to numbers alone. So I would like to ask, in the field of global public health, to what extent is qualitative research currently being used, or does quantitative methodology still dominate?
What is your question? I did not get it. What is the?
Okay. Basically, I would like to ask, in the field of global public health, to what extent is qualitative research currently being used? Or does quantitative methodology still dominate?
See, quantitative dominates, but now what is dominating is mixed method. So you cannot answer anything with only, just like I was explaining to Kamrun that, only quantitative will be incomplete, only qualitative will be incomplete. To give a proper, good, comprehensive idea, it has to be mixed method, so that you have your whats from your quantitative and your whys and hows from your qualitative. So if you see most of the papers that are being published, and then again, mixed method is again not, it's easy. It's not like quant and qual together. It has its own system and processes altogether. It's not like, okay, you know quantitative, you know qualitative, that means you know mixed method. No, that's a wrong perception. But mixed method is what is actually dominating nowadays in global public health.
Okay. Thank you, ma'am. Thank you.
Thank you.
Can you repeat? Would you mind to repeat again what is mixed method?
Mixed method is basically when you are actually doing quantitative and qualitative both, but there is a process to integration. Integration is a very important aspect in mixed method. It's not like you do it in silos and you say that you have done in mixed method. So mixed method has the component of integrating qualitative and quantitative, and there is a process to it. It's not easy. And integration happens at multiple levels. It's not only at analysis stage. So it has to be kept in mind. So just by knowing quantitative or qualitative, we don't become experts in mixed method. So that is one thing. But in global public health, mixed method is ruling now.
Okay. Thank you, ma'am.
Thank you. Yes, Mr. Ridha, you were like having some questions.
Thank you for giving me the floor again. I just wanted to know
Thank you.
how how should I determine what type of analysis I am going to do. When I should use thematic analysis, when I should do grounded theory or other analysis. That is my first question. And another question is if I conduct interviews in in sensitive issues and participants are there are some participants who are willing to uh, give written consent and some are not. In that situation, what should I do? I should I carry on who are not willing to give written consent, but they're allowing me to do interview in verbally.
So for consent bit, it is there are two kinds. Informed consent has to be taken, okay, but if somebody is not willing to give a written consent, you can take a verbal consent where you can record and the person saying that okay, I'm okay to give a consent, and somebody may not be willing to write. So verbal
But if
consent is
he
also.
didn't, if he doesn't allow recording to, what should I do? Yeah, should
Then you
I
don't
keep any
record.
witness for that?
No. Then you don't record. If somebody, that's why I'm always mentioning that if you're audio recording, it's always with consent. If somebody is not willing to give you consent for audio recording, you as a researcher have to write notes. If the person is not comfortable you writing notes also, then you have to do the interview, and the first thing you do after the interview is write the notes. Okay,
Got it.
so you have no other choice.
But in public health, donors are always look for sometimes look for the consent papers in written. In that case, should I report that there are some participants who were not willing to give written consent? Is it enough to for the donors?
So it is not a very important thing to mention, but you can always mention in the method section that this is what only two of them were not okay and we have taken verbal consent or whatever, okay. But if the person is not giving you consent, then you cannot do the interview at all.
I got it. Got it.
Yeah.
And
You have,
another question was regarding choosing the analysis process.
so whether you want to go for a grounded theory or a thematic analysis, word frequency, this is basically depends a lot on what you want to do with the data. Thematic analysis is the most commonly used way of analysis, but thematic analysis also has a lot of nitty-gritties, okay. So
Yeah.
you can also, there is a process of quantification of qualitative data. That's a mixed method thing where you actually quantify qualitative data, but that is not again through Braun and Clark. So there are ways of doing thematic analysis, reporting analysis data, but all depends on what you want to really report. If you want to build a theory, then you go for grounded theory. But grounded theory is when you're actually proposing a theory and that gets validated. So grounded theory you do, that becomes generalizable. Okay. So that
But
is
is it important to adopt any theory for thematic analysis?
you have a theoretical framework.
Yeah.
Theoretical framework is basically comes from your literature review in qualitative. Okay,
Yeah.
what does the literature say? And it's called a theoretical framework. Theoretical
Yeah.
framework. Okay.
Yeah.
And in analysis, if you are doing based on any kind of implementation framework, REAM, or CIFR and so on, if you're using all those frameworks, then you can arrange your data accordingly. That will get into deductive coding. So it depends on what you want to do again. Okay, so if
But
you're
it's not
using a
mandatory
framework,
to adopt any theoretical framework, right? In
no,
thematic analytics.
no, that's what I'm saying. If you are having a framework on which you want to build your data to, like for example, if you're using REAM data, a REAM framework, and you have done qualitative and you want to put that into REAM, then you have to use those data and your themes will become the components of REAM or CIFR. Okay, these are frameworks which are used in implementation research. Okay,
Okay.
so depending on what you want to do, what is your objective, that is important.
Okay. Just earlier, and participant named maybe Anika asked you regarding the opportunity for the qualitative research in public health. I would like to mention, like, I'm working in a public health organization in Bangladesh, and it's true that there is limited chance of qualitative research in this sector. I feel like that there is like qualitative research take more time and time consuming, and donors are not always fund for that timelines and that financial support. So what do you think, which makes it challenging to conduct in-depth qualitative studies in public health sector? Like, how can we design an efficient but rigorous qualitative research approach? Additionally, in public health research, there is a there is a like certain aim to knock the policy, like by disseminating the findings. So the policymakers always tend to prioritize quantitative data, like they're often overlook qualitative insights because they're more complex, like narratives. So how can we, who are working qualitative research in public health sector, can uh, present or disseminate our quality findings effectively that might influence policy and decision making? What do you think, in your opinion?
I think you are absolutely correct. Qualitative data is not something that is only qualitative data is not something which is mostly appreciated by the policymakers, and they need numbers. Okay, so if I say that what is the prevalence of anemia in this particular state, I would need numbers to show that okay, there has been, this is the prevalence. The next time the policymaker asks that, I cannot just say high, I need a number for it. And if I see a decline or a increase, I have to say that okay, this has increased by 2% or declined by 3%, whatever. But I also have to say why this has happened. So in that case, when I'm saying that okay, if the policymaker asks okay, it has decreased, but then why has it decreased? Why has it not decreased in other state? In that case, it is your qualitative that will help you. So that is why I was saying that mixed method is what has actually come up as a dominating research design nowadays, where quant is actually complemented by qualitative. Qualitative is time taking. So qualitative is basically your data collection becomes fast because you have to just do interviews, and it's like one hour, and your sample size is also like 20-25 max for a particular homogeneous group. So data collection is fast, but analysis takes a lot of time. For
But if you
qualitative,
do participant observation or like any study like ethnography, it takes more time, which is in
I'm
current
saying
situation is not allowed actually.
definitely. I'm not talking about those very specialized qualitative research. I'm
Okay.
talking about something that you otherwise generally can do. For participant, where you are actually doing ethnographical studies, you have to go and live with the community for months. That is different. I'm saying about data collection for otherwise doing an interviews, IDIs, KIIs, and all that. It is faster, but analysis will take you time. For quantitative, data collection will take a lot of time, because you have to hit that sample size, your target sample size, but analysis is faster. Both are resource consuming, and you have to design your research study based on the resources available to you. So that is why I was telling, I don't remember that, it's just not about selecting where you want to go. Resources permitting, you have to design your study accordingly. What is feasible for you to do? That is what it is.
Yeah. Thank you. Thanks a lot for your passionate answer.
Thank you.
Ma'am, can we get the recording and PPT of this session?
Again, that is for the organizers to answer, please.
Yes, you will get the recording. The link will be provided in the WhatsApp group.
Thank you.
So I'm pasting my LinkedIn link here. Please feel free to connect. And we have some YouTube videos also. As young researchers, feel free to, so I think BIIHR anyways uploads these sessions on YouTube. I don't know if they do it still. Do you all still do it?
Yes, ma'am.
Yeah. So that is there. And so for early career researchers, our organization also has a YouTube channel. You all are free, feel free to visit that. There are certain basic videos on it, on research. All are on research. So you can visit, you can see. And if you have any questions, please feel to reach out. That is all. And I hope this session was useful.
It was fantastic. Thank you.
Thank you so much.
I think there is no other question.
Thank you. Thank you so much.
Dr. Mukherjee, for such an insightful and engaging session on qualitative research in public health. And also thank you all for participating with us today. On behalf of BIIHR, we truly appreciate your presence and look forward to welcoming you in our upcoming session. Have a wonderful evening, everyone. Thank you.
Thank you. Thank you so much. Thank you, BIIHR. Thank you.
Thank you, ma'am.
Thank you.